Hi, I'm Dr. Valerie Bentley. Today I'm going to be guiding a body scan. A body scan is a powerful tool and a way to connect with your own body, and also a way to nurture your own sense of well-being. So I would encourage you to listen closely and follow the best you can with the guidance that I'm offering. Also, you may notice that as we move through the various parts of the body, you may notice a variety of sensations. There may be tingling, heaviness, lightness, warmth, coolness, any number of sensations that come up. And you might notice a tendency to want the body to feel a certain way or to try to create a particular sensation in the body. You may also notice as certain emotions or thoughts come up, you may want to create a certain mind state, maybe a state of relaxation or ease. Rather than doing this, however, the invitation is to instead just explore what's there. Just becoming aware of what is going on right now in the body. Now, as you do this, you may well notice that the body does tend to relax, and you may experience a letting go of tension and more ease and comfort. But whether or not that happens, just focusing on whatever sensations do present themselves is likely to result in the best outcomes. So if you'll join me, the body scan is typically done laying down. So if you would like to lay down on a mat, on the floor, or on your bed, that is preferable. But if that's uncomfortable for you, you can also feel free to lie on your side, or the body scan can be done sitting in a chair. The posture doesn't matter so much as the quality of attention that you bring to the body scan. So I will be guiding it as if you were laying down. So if you'd like to go ahead and lay down on your back, letting the arms rest by your side, feet falling away from each other, maybe bringing the shoulders down a little bit away from the ears. And if you're comfortable, allowing the eyes to close. And just becoming aware of the breath. Really sensing the breath in the body. It may be helpful for you to place your hand on your abdomen so that you can more fully connect with the sensations of the breath in the belly. Noticing the hand rising and falling with the breath. And if you like, letting your hand lay by your side again. Continuing to sense the breath in the body and perhaps becoming aware of all the parts of the body that are making contact with the ground or with your bed or your mattress or the floor, the back of the head, maybe the shoulder blades, parts of the legs, the heels. Seeing if it might be possible to just let go a bit and allow the floor to hold you. And now on the next in-breath, bringing the awareness down into the feet. Both feet, right down into the toes. And just becoming aware of any and all sensations in the toes. Perhaps aware of the sensation of the stockings on the toes or the air touching the toes. Any sense of dryness, dampness, coolness, warmth, just noticing how it is with the toes. And if, when you focus on your toes, you don't notice anything at all, then just being aware of that. Awareness of no sensation is still awareness. And allowing the awareness to move along the bottoms of the feet, the arches, wrapping around to the top of the feet, including the heels and the ankles. Sensing the surface of the feet, but also aware of the bones and the tiny muscles in the feet. And on the next out-breath, letting go of the awareness of the feet, and on the in-breath, bringing the awareness into the lower legs. Sensing the calves and the shins. And here too, aware of the surface, the skin, but also sensing the muscles, the calves, the bones of the lower legs. Moving up, including the knees. Sensing the tendons, the kneecap. Considering how many times these knees bend, carrying us about during the day. And for the most part, we never give much thought to them unless they're giving us difficulty, but now just sensing how it is with your own knees. And on the out-breath, letting go of the awareness of the lower legs and the knees, and on the in-breath, bringing the awareness into the thighs. And really sensing the large muscles, the large bone of the thigh, the femur. Maybe noticing the parts of the thighs that are making contact with the floor or with your mattress or with the chair. And taking just a moment to allow the awareness to spread back down, starting at the hips on the outside of the legs and the inner thighs on the inside, and allowing the awareness to just spread back down to include the thighs and the knees and the lower legs, the ankles, the feet, the toes, and for just a moment, sensing the entirety of both legs. Any sensations of heaviness or lightness, tightness, looseness, just sensing how it is right now with these legs. And on the next out breath, letting go of a sense of the legs, and on the in breath, bringing the awareness into the area of the pelvis, the area between the right hip bone and the left hip bone, the buttocks, sensing where they may be making contact with the chair or with the floor or your bed. muscles in this part of the body, as well as the organs that reside in this part of the body. Organs associated with reproduction and elimination. And allowing the awareness to move around to the back side of the body and coming up out of the pelvis, becoming aware of the spine, the curve of the spine at the lower back, as well as the muscles, the skin, moving up along the spine to the mid-back, upper back, maybe sensing the expansion of the ribs on the back side of the body. The shoulder blades. And moving back down along the back, wrapping around to the front side of the body, becoming aware of the stomach, the area around the navel. Maybe sensing the breath here. And here too, considering the organs that reside in this part of the body, so important. The liver, the kidneys, the stomach. Moving up into the chest. Perhaps really accessing the breath with the expansion of the lungs. Maybe sensing the beating of your own heart. And allowing the awareness to spread back down, beginning at the shoulders and moving back down through the stomach and the pelvis, and for just a moment, holding in awareness the entirety of the torso, including the back side of the body, just breathing into this core part of the body. And on the out-breath, letting go of a sense of the torso. And on the in-breath, bringing the awareness all the way down into the fingers and the thumbs of the hands. Perhaps sensing the air on the fingers and the thumbs, sensing the palms of the hands, the backs of the hands. Be aware of the part of the hands that may be touching the floor or your mattress, and including the wrists. And moving up into the forearms, all the way up to the elbows. The upper arm, the biceps and triceps. And coming up into the shoulders, and perhaps taking just a moment to breathe some nurturing, some care into the shoulders. The shoulders are a part of the body where many of us experience tension, where we can hold stress. And so if you like, perhaps breathing in directly to the shoulders, and on the out breath, seeing if you can breathe out a little tension or tightness. And if that happens, then just noticing that, and if it doesn't, then just noticing that. And now for just a moment, allowing the awareness to spread back down through the arms, the elbows, the forearms, the wrists, the hands, the fingers, the thumbs, and for a moment, holding the entirety of both arms in awareness. And letting go of a sense of the arms, bringing the awareness into the neck. Perhaps sensing the air faintly as it moves through the neck. Considering the bones, the muscles of this neck that holds up the head. And moving up into the jaw. And bringing the awareness to the mouth, the lips, the tongue, the teeth, the inside of the mouth, the upper lip, perhaps sensing the air as it leaves the body through the nostrils and touches the upper lip, the nose, eyes, and perhaps allowing the area around the eyes to soften just a bit on the next out-breath. Becoming aware of the cheekbones and the forehead and the entirety of the face. This face that we present to the world, but now allowing it to just be at rest, to be as it is. And wrapping around to the sides of the head, becoming aware of the ears and any sounds that may be arriving at the ears, as well as sensations around the ears, perhaps sensing the hair. Moving around to the back of the head, perhaps sensing the weight, where the head is resting on the floor or on your bed. The top of the head. Here too, for just a moment, holding in awareness the entirety of the head. And considering also the brain, which is so important for every aspect of life. And the skull. And now, beginning at the top of the head, allowing the awareness to spread back down through the body, through the face and the neck, the shoulders, the chest, the stomach, the pelvis, the arms, the hands, the thighs, the knees, the lower legs, the feet, the toes. And for just a few moments, holding the entire body in awareness, sensing the best you can, the whole body, perhaps sensing the breath in the whole body being filled with air on the in-breath, the air leaving the whole body on the out-breath. And just taking a few more breaths with awareness of the whole body breathing. And perhaps taking just a moment to breathe in some appreciation to this body. There can be a tendency to focus on what's wrong with the body, but from a mindfulness perspective, as long as you're breathing and your heart is beating, there's so much more right with you than wrong with you, no matter what is wrong with you. And so breathing, some nurturing, some appreciation. Into this body. And when you're ready, perhaps taking one or two intentionally deeper breaths and beginning to bring a little movement back into your toes and your fingers. Maybe gently moving the head from side to side and opening the eyes. And when you're ready, in your own way, working your way back up to a sitting position. And so maybe feeling a bit more connected with your body, a little more embodied. This is a practice that can have some powerful benefits for your health and well-being. And so if it makes sense to you, perhaps engaging in it on a regular basis. Thank you.